Hi, everybody. My name is Jasmine. I'm a JCC student, and today we're going to be talking about risk factors and transition period for newborns. And this one is going to be talking about cold stress. So, what exactly is cold stress? Cold stress is when the pathophysiological process of cold stress, what we're going to talk about first. Um, so what actually happens? So you have when an infant gets cold, okay, they have a release of norepinephrine, okay? Oh my God, it's too early for this. Yeah, parents. And norepinephrine is a catecholamine that deals with mostly the blood vessels response when you have a pressure changes or any type of change stress related in the body. So when the baby gets cold, they release this norepinephrine in their body. So what it does three things. It does something to the lungs, the liver, and the pancreas. The pancreas and the liver affect the metabolic process of the baby, just like for us too. They help with our metabolism. So what happens to the lungs is that the lungs they constrict, vasoconstriction. So when that happens, there is a decrease in O2, which is called hypoxemia, and I want to say can cause acidemia. Yes. Okay. So now you're not getting as much oxygen to the lungs that you should be because your body is now the in regards to a baby's body, their bodies can only do one thing at a time. So if they're cold, they're going to deal with that immediate threat and neglect everything else. So, and then if it's affecting the lungs to such a severe state, should have a room. It's gonna affect it, right? But why surfactant? Okay, surfactant is made up of what we use for energy. Surfactant is made up of lipids and protein. So, a decrease um, in surfactant is around the alveoli to help them expand and to reduce surface tension. Okay, but if you don't have surfactant to aid your alveoli to expand when you're breathing in, your alveoli are going to eventually collapse. And you don't want that to happen. But unfortunately, when it comes to a child, and them trying to breathe, that does have the possibility of happening. Another one that encompasses these two is called increased. Increased anaerobic response. Right. So what is that, right? Increased anaerobic response means that they're going to use their non-estressified fatty acids for energy, right? So what's going to happen for these two? The liver is now going to no longer have the ability to break down bilirubin, which is a waste products, right? So it's going to cause hyperbilirubin, and then for the pancreas, they're trying to use all these glycogen stores. So it's going to have hypoglycemia. Let me make sure I said that right. So what's actually going on? I had to do a lot of research in this, and I actually wrote it down on my paper. So the baby is using energy through the breakdown of carbohydrates and fatty acids because the lungs cannot produce enough oxygen in response to the demand of the cold stress. So, and keep in mind too, when we're talking about lung expansion for infants, they only have 25 million alveoli. That may seem like a lot, but an adult has 600 million. So they don't have enough to compensate breathing in all the oxygen. And they can only breathe it in one place, to their nose, up until they're 4 weeks old. So they just, their bodies are working themselves. So this is what happens in terms of cold stress. I want to say this again. The body for a baby releases norepinephrine, which causes the blood vessels, and then it causes vasoconstriction of the blood vessels. So, and then with the lungs, it will constrict the lung, the pulmonary vasoconstriction. So if you don't have your pulmonary arteries um, recycling or getting oxygen, enough oxygen, you're gonna decrease the O2 because they need the O2 for energy. So it's gonna cause low O2 in the blood, acidemia, metabolic acidosis, decrease in surfactant because they're taking the lipids and the proteins that are used to make surfactant away. The liver and the pancreas are involved in the increased anaerobic non-esterified fatty acid process. So the liver will no longer be using the water and the protein to break down the bilirubin. So you're going to have hyperbilirubinemia. And then with the pancreas, it's going to no, it's going to because the pancreas deals with blood glucose, and it's really immature too, so it doesn't really know how to respond that well either. So you're gonna have hypoglycemia with a child with cold stress. Now let's talk about risk factors. So who's mostly at risk? So the children who are most at risk are premature children, small gestational age children, diabetic mom children, or GBS, or children who come out with hypoglycemia, anything to do with diabetes, and post-term. Now, what are the signs and symptoms of cold stress, right? I tried to simplify this in the best way I could. So, how do we know an infant has cold stress when they come out? Immediately, when we look at their skin, it's going to be pale, pallor. Um, it's going to be cool. Now, how do you think their energy is going to be? In regards to tone, they're going to be hypotonic. They're not going to want to move. They're going to be lethargic, as in really tired, like don't want to do anything. The respirations are going to be high because they're even though the O2 level in the blood is low, they're trying to compensate for that by breathing harder. So they're going to look like they have silent symptoms of respiratory distress syndrome. So, you're gonna have increased respirations. And then you're gonna see them breathing in harder, grunting. You're gonna see it when you do your assessment. And they're feeding. They're not really gonna want to feed. So when you try to feed them, it's gonna be weak because again, they can only breathe out one area on their mouth, which is their nose. So if you're trying to feed them, they're not necessarily going to want to feed because they're trying to breathe. Um, yes, and they're going to be jittery too. Jittery, the jitteriness is in correlation or can be in correlation with the diabetes if the child has is hypoglycemic, which is one of the risk factors. So what are we going to do to prevent this? We have to do their temperature checks, okay? Check temperature. And then we want to keep them warm. That is a priority. We have to dry them off, which we know that. Keep them warm how? We have to put a cap on their heads as soon as they come out. Um, we're going to have to, we can get warm humidified O2 air so they don't have to try so hard. Um, now, you're not going to give them a bath. Why? You're going to delay the bath because let's say their temperature is 90, the average temperature for a child is 97.7 to 99. Our instructor said that the temperature has to be at least 98 in order for you to give them a bath. And there's other requirements to give them a bath. You have to check their temperature, you have to check their blood glucose level 3 times to make sure it's stable. They have to be at least 6 hours old, and they have to feed. If they can't feed, there's something going on. Um, so those are the 3 things you have to make sure that you do before you even give them a bath. And other stuff for especially diabetes. But you just want to maintain their thermal environment. They were in a room where it was warm and comfortable for them. So now they're outside. Hospitals, unfortunately, are kept cold due to sterile, trying to keep the area sterile, especially if the mom had a C-section or even no, not really vaginally, but let's say the baby had a C-section. But in general, when the kid is having, when the mom has surgery to have the kid, it's a sterile environment and it's cold. Okay, so it's a really shock to their system. So you just want to make sure that they stay warm. And I want to talk about brown fat for a minute. Preemies, brown fat doesn't really fully develop until late second trimester. So if a preemie is born at 20 weeks, like they're not gonna have a lot of brown fat. Small gestational age children not gonna have a lot of brown fat. Post-term children, they may or may not. And diabetic children, I'm getting to in another one. But brown fat plays a role. It's very dense and very vascular. But once they use it, it is gone. And if they don't get, and it only happens in utero. So if they're not getting that brown fat developed the way it's supposed to, um, they're when they come out, that's what they have. And once they deplete it, it is gone. So this is the missing anything. I think I did. And obviously, you know that this kind of hypothermia. Everyone knows that. Um, okay. So one more thing. Obviously, we're gonna warm our blankets and beds if we suspect this. But if they have a very low birth weight, right here, very low birth weight. The average weight of a child is 2,700 to 4,000 grams. A very low birth weight is 1,500 grams, right? Those children are at an extreme risk. And they are, she said, they're going to be poly, can't spell that, excuse me, polyethylene is going to be used for them. Okay. So, um, they're very low birth weight. Small gestational age babies are very low birth rates. But I'm going to get into that a little later. But you want to watch out for these 1,500 gram babies too. And I think that's it for co stress. All right. See you guys later. Bye.